There are different types of trials. Some are where the drug, not a lot is known about the drug and how it works when it's given to humans. And so the first stage in development of a drug is to find out what dose is suitable. And so that's done by taking groups of patients and gradually giving them an increasing dose of drug until they start seeing side effects. And then that defines the maximum dose that patients can be given. That's a so-called phase 1 trial. And then the next thing that people try to do is find out, and they may see some responses in a trial at that, but then they would take that dose they discovered and then look at more patients and see what proportion of patients got a response. And if that's encouraging, then they would say, well, maybe we've got a drug here that's really worth further development, and they would take that into what's called a phase 3 trial or a randomized trial anyway, where they compare it maybe with the standard care that's already available, plus either the standard of care with this drug or this drug on its own. And that's the big phase 3 trials that take 3, 4, 5 years. So it's quite an expensive and quite a long procedure, and patients can back out of it any time. They're not imprisoned in a trial just because they volunteer at the beginning. As I say, it's pretty unusual for patients to be worse off being in a clinical trial, but the drug may not work, and so they may not benefit. Everybody goes in optimistic, but they don't always work.